video, I'll be sharing some important medical advice to all eye patients. I noticed that some eye patients, when they visit the hospital, perhaps to see an eye medical doctor, after seeing the medical doctor, complain the condition of the eye, what is wrong with the eye, and the medical doctor put down his prescription concerning the eye via the drugs that will take care of it. Then the patient takes the prescription to the hospital pharmacy or to outside pharmacy so as to get the drugs. Now, after the pharmacist has assessed the prescription, then dispense the drug. Next thing you will hear from the patient is, I have this drug now. I have it up to 3 sef in my house. Why will doctor prescribe this to me, this and that? Please, the doctor cannot just make such mistake if he had known you have it. So with this, I am begging, I am pleading with all eye patients. Whenever you are visiting the hospital, especially eye clinic, whenever you are visiting the eye clinic, come with your drugs. If you know you have some eye drops, some eye ointment, eye tablets, whatsoever, come with it to the hospital. Tell the doctor, I have this, I have that. The doctor will now know, wow, look at what you have, then will not prescribe any drug you have. Yes. Then if as you bring the drug, there is one of the drugs or two or three you have been using and you are not finding it funny, it's giving you allergy, you are reacting to it negatively. You are not enjoying the drug. Now, it is with that carrying your drugs to the hospital, it is with that opportunity that you can now tell the doctor, please, anytime I put this drug, this eye drop, it causes this to me, it does this to me. Believe me, the doctor will not prescribe it again for you to take. He will change it to another eye drops because we have many eye drops to be used in treating a particular eye condition. It depends on a lot of factors before a doctor will prescribe it to someone. So if you are reacting to one, that does not mean you will react to all of it. There will be one of them that will be okay by you. Yes, we have many eye drops. You can see this is one of it. This is another one. These ones are ointment. But in this video, we will not be discussing on when to use a particular eye drops. It's not your duty. Go to medical school, you can learn that. Okay? Now, I only want to limit my video on medical advice. So one medical advice I just delivered now is, if you know you have eye problem, you have some drugs with you at home and you want to visit the hospital, you want to see your doctor concerning a particular eye issue you have, please, while going, come with all your drugs. I repeat, come with all your drugs. In fact, not just eye clinic. If you have other health issues and you want to visit the hospital, please come with all the drugs you have at home. With that, doctors will know, wow, you have this, you don't have this, okay, and all have you. And you will save your money from buying what you have. Two, you will get the best drug that will take care of your health issue, especially in this video, the eye issue you have. That is one. I also noticed that some patients do not know the best way, the best procedure to administer their eye drops or their eye ointment. Yes, I noticed that. Please and please, let's see the procedure. First thing is, sit down comfortably and pull your head back. That means standing up while taking your eye drops, eye ointment is very inappropriate. It's very wrong. Yes. Now, use one of your fingers and pull down your lower eyelid. This part of your eye is called lower eyelid. So when I pull my head back while sitting down, I have to use one of my fingers and pull it away from my eye. Once I do that, I will take the eye drop or the eye ointment, whichever is the case, and give it to someone and say, please put it into my what eye. So as you put your lower eyelid away from your eye, you have created a pocket, a space in your eye for the eye drops to enter. Now, after putting the one drop into your eye, if it is one drop, if it is two drop, after putting it into your eye, please don't just lower your head. Remain in that mood for some minutes. Why? To allow the eye drop to enter well into your eye. Now, wait for like 15 minutes for it to enter. Don't rush it. That is why you can't take it while standing, because while standing like this, you can get tired and decide to pull it down. So just remain like this till 15 minutes at least, so that it will enter well. Then blink your eyes. Blink it so that it will circulate well to all your eye. The remaining part of whichever drop that fell out of your eye, use a clean hanky to clean it off. If you have two eye drops or eye ointment for you to take, because of the situation of your eye, it warranted that you need two or three eye drops to take care of it. Please, at that time you waited for 15 minutes, you can now take the second one and put. That means the reason why you are giving a space of time is one, for each drop you put into your eye to be absorbed well by your eye, to enter well into your eye and work well. That is one of the reasons. Two is that if you have two or more eye drops to put, as you are putting the second one will see space to enter, and it will enter well and work well. Another one is, as you are putting the second one after the space of time, after that like 15-20 minutes, and after that at least 15 minutes, as you are putting the second or the third one, whichever one, if there will be an interaction, if the two drops, the first one you put and the second one you are putting, if the two will fight in your eye, it will minimize that. It will avoid it. It will make it possible that the two drugs will not fight, because the first one has entered, in fact it's working already. Then the second one will see space to enter and go and do its own work, so they will not fight. Now, another advice I want to give to all eye patients is, please, if a doctor asks you to use a particular drug, if a pharmacist asks you to use a particular eye drop for 1 month, for 2 weeks, for 1 week, there are reasons for that. Take this eye drop 3 times daily, 4 times daily, morning, afternoon and night, morning and night. At night only, there are reasons. Take for instance, there are these anti-glucamic agents that is taken at night only. Yes, I will not mention name, but if you fail to if you fail not to take it at that night, do you expect it to work well the way you want it to work? No, because you take it at the wrong time. Please, Any drug they say take morning and night, morning, afternoon and night, only at night. Please don't change the prescription by yourself and take anytime you like. That will make it not to work for you. If you take it how it is being prescribed to you, believe me, you will enjoy the effect of that drug and you enjoy everything about it. You get well as fast as possible. Yes. Another point is, if you are asked to take that drug for 1 week, 2 weeks, 1 month, please, when you take that drug for that 1 week and it's still remaining, don't continue taking it. Please, if the issue is still getting worse or is not getting better, rush back to that medical doctor, rush back to that pharmacist. Tell him or her, please, this drug, I've finished taking it as you said for 1 week, but I'm not getting better. You can see it's getting worse. Then the doctor will look at it, check it well, and there is possibility that the prescription will change to another eye drop. So do not continue taking a particular eye drops or ointment more than the duration, the time you are asked to take it. Please see your medical doctor, see your pharmacist. That is why you have them. They are your friends to help you. Yes, it is noted that today, being October 13, 2022, is World Sight Day. I want to use this opportunity to say a very big happy World Sight Day to all the patients, to all my friends, to all my family members, to all the medical professionals